about would taking the thyroid out, would a thyroidectomy cure Hashimoto's, and we indicated that that was not the case, and the reasons why. Today, the question is, when do you take the thyroid out? If there's a time to take the thyroid out, do you take the thyroid out? And interestingly enough, I haven't gotten any questions that I can remember about radiation and Hashimoto's, which is kind of crazy. So we'll cover that too. So basically, never, no, close to never. Look, here's the deal. Right now, we're in a spot where the medical community, which is, this is funny, I was just having this conversation with a nurse just 2 days ago. The medical community still is thinking that Hashimoto's is a thyroid disease and only a thyroid disease, and they're not treating it as an autoimmune problem, as we've talked about previously. So we should be treating the immune system to dampen inflammation against the thyroid. So there's a hierarchy as to treatment. I'm not never take your thyroid out, but I'm close to that, okay? I mean, mine's not coming out. Spoiler alert, as they say, mine's not coming out unless somebody tells me I have definitively have thyroid cancer. That's it. That's when it's coming out. But, you know, a little bit of background on that. Because the medical community is now becoming aware of Hashimoto's, but they don't particularly have an agreement among doctors as to how to treat it, you'll have some people give you thyroid medication still and not do anything about the immune system. There are some people in the medical field that are trying to do the immune system by giving people hydrocortisone, maybe some low-dose naltrexone, to calm inflammation down. These doctors are far and few between, but they're at least thinking of addressing the immune system. And then if that doesn't happen, then they're going to start. Then they're going to start going, well, maybe we should just take it out, and then we'll moderate your hormone levels by just giving you medication. The problem is there's a lot more to it than that. A lot more to it than that. You don't just take medications and all of a sudden everything corrects when you have Hashimoto's. There's so much more than that. I don't have time to talk about that in these daily segments. But the other thing is they might, before that, so they might say, you know what, let's just irradiate it, or let's just take it out. I'm seeing that a lot. Let's just radiate it, let's just take it out. That's not a good enough reason for me to take out my thyroid. Okay, and by the way, most of you probably know I have Hashimoto's. So, so the other pathway could be that you go to the doctor, you have an enlarged thyroid, or you have nodules. They end up taking a biopsy, and here's what they go. Here's what they say. They say you have abnormal tissues in there, undifferentiated abnormal tissues in there. So maybe we'll just take that part of the thyroid out. I wouldn't do that. And I'll tell you why I wouldn't do that, because more and more it's becoming apparent that those undifferentiated, abnormal, unidentifiable cells are because of Hashimoto's. But that's not quite been embraced completely by the people who are taking out thyroids at this point in time. So an enlargement, now most enlargements are not cancer. I would say all enlargements are not cancer. Most enlargements are immune inflammation from Hashimoto's. We have a lot of people, their Hashimoto's gets under control through diet, through dampening stress responses, through figuring out which drugs are contributing to the inflammation, and all the things that we've talked about that will dampen inflammatory responses and then help your thyroid start working well again. You can do all that. You could maybe if they wanted to, they found out the undifferentiated cells and you wanted to have them take that little bit out. They may recommend that, oh, let's just take this little bit out. But it's always going to come out to Hashimoto's or cancer. Now, cancer. Now, if I have nodules, if I have enlargements, if I have Hashimoto's that they're just not able to manage with the medications, even if I shouldn't say even if you can't manage them with alternative medicine, but not everybody's doing the whole flow of alternative medicine. So I would still look around. If it's not cancer, I'd be looking around. Not cancer, okay? Usually it's a small nodule. Usually cancer comes with a nodule. Usually it's tender. They're gonna biopsy it and they're gonna go, you have cancer. You have cancer cells there. I'm getting it out. Just some of my colleagues might even disagree with me, but you're watching me, not them. So basically, at that point, I will get that out. Okay, I think I would take the cancerous part out. Now, some people are going to take the whole thing out. I'm not all over that. You have 4 lobes. If I'm in this lobe, I'm getting that lobe taken out, and I'm leaving the rest. So that's a very good question. It's still a very tricky question. I don't know if there's going to be an agreement reached anytime soon in the medical community as to when to leave it in and when to leave it out. There's a lot of concern with a doctor as to whether they leave those undifferentiated cells in there. Maybe one day they turn out to be cancer, and then the patient turns around and sues them. That is a consideration on the doctor's part. That's at least part of why more of them are coming out. Part of them, they just don't know what to do with it. So doctors give medication and take things out. That's what they do. That's their world. Their world is the world of pathology. Cancer is pathology. Hashimoto's is not pathology. Hashimoto's is autoimmune. So I think that's a pretty good answer. That's how I answer it when my patients come in here. That's how I manage it. I do work with doctors on these things, and I feel very comfortable with giving you that advice. So see you tomorrow.